Blotchy skin is a very common skin concern that affects people of all ages and skin type. It refers to uneven patches of redness and discoloration and irregular tone that can appear suddenly or develop over time. In most cases, blotchy skin is harmless, but it can sometimes signal an underlying condition that needs treatment. The key to managing blotchy skin is understanding what is causing it in the first place. Hi, I'm Dr. Morgana Colombo. I'm a board certified dermatologist in Northern Virginia and founder of Vida Derma, a skin care line backed by science and aim to help women as they age. So before we get into how to get rid of blotchy skin, let me tell you what causes it. Blotchy skin has many different causes. Blotchy skin can happen for several reasons, ranging from simple environmental triggers to chronic skin conditions. One of the most common causes is livedo reticularis, which creates a lacy purplish pattern on the skin. This often happens when blood vessels temporarily constrict, especially in cold weather, and usually resolves with warming. Another frequent cause of blotchy skin is tinea versicolor. That's a fungal condition that leads to lighter and darker patches on the chest, back, shoulders. This occurs when yeast that normally lives on the skin grows excessively. Inflammation is another big driver of blotchy skin. Inflammatory skin conditions such as eczema can lead to blotchy skin. Eczema causes redness, dryness, and itching, and over time, it can leave behind uneven pigmentation. One of the most important concepts to understand is that inflammation play a major role in blotchy skin. When the skin becomes irritated, whether from allergens, dryness, or infection, it responds by increasing blood flow and activating immune pathways. These can lead to redness, patchiness, and uneven tone. So conditions like eczema, contact dermatitis, and even mild irritation from skincare products can all trigger this inflammatory response. Over time, repeated inflammation can disrupt normal pigmentation, making the skin look uneven even after the redness fades. Blotchy skin is not always due to inflammation alone. Infections, especially fungal ones like tinea versicolor, can directly change how your skin looks. These infections interfere with normal pigment production, leading to areas that appear lighter or darker than your surrounding skin. External triggers also play a large role. Cold weather can cause temporary patterns due to blood vessel constriction. Certain medications can lead to rashes that appear days to weeks after starting a new drug. Viral infections can also cause short-term blotchy rashes, often those are going to be accompanied by fever or other symptoms. It is important to understand that not all blotchy skin is dangerous. In fact, many causes are completely benign. For example, livedo reticularis is typically harmless and resolves on its own. Pityriasis alba, which causes light patches on the face and arms, is also a self-limited condition that improves over time. These conditions may look concerning, but they usually do not require aggressive treatment. Instead, they benefit from simple measures like moisturizing, sun protection, and patience as the skin gradually returns to normal. How can you treat your blotchy skin? This is where it can be tough because there's no one size fits all. Treatment for blotchy skin can be, varied. This is because the cause of blotchy skin determines the solution. If the issue is fungal, antifungal treatments such as medicated washes or creams are often effective. If inflammation is the main driver, treatment focuses on calming the skin with moisturizers, gentle skincare, and sometimes prescription creams that are anti-inflammatory. For eczema-related blotchiness, restoring the skin barrier is key. This includes using fragrance-free moisturizers, avoiding triggers, and maintaining consistent skincare routines. If medications are the cause, stopping or switching the offending drug offender under medical guidance is usually necessary. An important point is that even after treatment, the skin may take weeks to months to return to its normal color. So patience is really key. This is especially true for conditions such as tinea versicolor, where pigment recovery is really delayed. It can take actually months for it to recover. Daily habits play a major role in preventing and improving blotching skin. Using gentle cleansers and avoiding harsh or fragrance products can reduce irritation. Keeping skin well moisturized helps maintain a healthy barrier which protects against inflammation and environmental damage. Sun protection is also critical. Ultraviolet or UV exposure can worsen uneven pigmentation and make blotchy areas even more noticeable. Avoiding very hot showers and minimizing skin trauma, such as scratching or overexfoliating, can further prevent flare ups. While most cases of blotchy skin are harmless, there are situations where you should seek medical attention. So these are going to include the rash that does not fade when pressed, rapid spreading of the rash, severe pain, blistering, or symptoms with fever and difficulty breathing. These signs may indicate a more serious condition that requires prompt evaluation and treatment by a dermatologist. Blotchy skin is not a single condition, but a symptom with many possible causes. The most effective way to treat is to identify what's driving it, whether that is inflammation, infection, environmental triggers, or a benign vascular response. Once the underlying cause is addressed, most cases improve significantly. With the right diagnosis, targeted treatment, and consistent skincare habits, blotchy skin is often very manageable and in many cases completely reversible. So, what questions do you have about your skin? Drop them in the comments below and I will make a video about it. Thanks for watching and remember to hit like and subscribe and I will see you in the next video.